Gallstones are solid particles that form in the gallbladder, a small pear-shaped organ located beneath the liver. The gallbladder stores bile, a fluid produced by the liver that helps in the digestion of fats. Gallstones can vary in size, from small sand-like particles to larger, pebble-sized stones. There are two main types of gallstones. Cholesterol stones. These are the most common type and are primarily made up of cholesterol. They form when there is an excess of cholesterol in the bile, and the bile becomes supersaturated with cholesterol, leading to its crystallization. Pigment stones. These stones are less common and are composed of bilirubin, a component of bile. Bilirubin is a byproduct of red blood cell breakdown. When there is an excessive amount of bilirubin in the bile, it can lead to the formation of pigment stones. Gallstones can cause various symptoms, but it's important to note that some people with gallstones may not experience any noticeable symptoms, asymptomatic gallstones. When symptoms do occur, they can range from mild discomfort to severe pain. Common symptoms of gallstones include pain. The most common symptom of gallstones is a sudden and intense pain known as a gallbladder attack. The pain typically occurs in the upper right or middle abdomen and may also be felt in the back or right shoulder. The pain can be steady or cramp-like and may last for several minutes to several hours. Nausea and vomiting. Gallstones can cause nausea and vomiting, especially during a gallbladder attack. Indigestion and bloating. Some people with gallstones may experience indigestion, gas, and bloating. Belching. Excessive belching or burping can occur in some cases. Jaundice. If a gallstone becomes lodged in the bile duct, it can block the flow of bile, leading to jaundice. Jaundice is characterized by yellowing of the skin and the whites of the eyes. Clay-colored stools. When the flow of bile is obstructed, stools may become pale or clay-colored. Fever and chills. In cases where the gallbladder becomes inflamed or infected, cholecystitis, fever, and chills may be present. The formation of gallstones is a complex process influenced by various factors. The two main types of gallstones, cholesterol stones, and pigment stones, have different underlying causes. Here's an overview of the causes of each type. Cholesterol stones. Cholesterol stones are the most common type of gallstones and are primarily composed of cholesterol. The formation of cholesterol stones is often related to an imbalance in the components of bile, leading to the crystallization of cholesterol. The main causes of cholesterol stones include excess cholesterol in bile. When there is an overabundance of cholesterol in the bile, it can lead to the formation of cholesterol crystals, which eventually grow into gallstones. The exact reasons for this cholesterol imbalance can vary among individuals, but factors like diet, genetics, and liver function play significant roles. Low bile salts. Bile salts are essential for the breakdown and absorption of fats. If the concentration of bile salts in bile is too low, it can contribute to the precipitation of cholesterol and the formation of stones. Gallbladder motility issues. If the gallbladder does not empty properly or if it does not contract efficiently, bile may become stagnant, promoting stone formation. Pigment stones. Pigment stones are less common than cholesterol stones and are primarily composed of bilirubin, a component of bile. Bilirubin is a yellowish pigment produced during the normal breakdown of red blood cells. The main causes of pigment stones include excess bilirubin. When there is an excessive amount of bilirubin in the bile, it can lead to the formation of pigment stones. Conditions that increase the breakdown of red blood cells or impair the liver's ability to process bilirubin, such as certain blood disorders or liver diseases, can contribute to this problem. Biliary tract infections. Infections in the biliary tract can lead to the formation of pigment stones, as bacteria can alter the composition of bile and promote stone formation. It's important to note that several risk factors can increase the likelihood of developing gallstones. These risk factors include gender. Women are more prone to gallstones than men, especially during pregnancy or when using hormone replacement therapy. Age. The risk of gallstones increases with age, especially in people over 40. Obesity and high-fat diets. Being overweight or consuming a diet high in saturated fats and cholesterol can contribute to the development of gallstones. Rapid weight loss. Losing weight too quickly can increase the risk of gallstones. Family history. A family history of gallstones may raise the likelihood of developing them. Certain medical conditions. Certain conditions, such as diabetes, liver cirrhosis, and inflammatory bowel disease, can increase the risk of gallstones. Certain medications. Some medications, like cholesterol-lowering drugs, can raise the risk of gallstones in some individuals. The treatment of gallstones depends on the severity of symptoms and the presence of complications. In some cases, gallstones may not cause any symptoms and can be managed without intervention. However, if gallstones lead to significant pain, inflammation, or other complications, treatment options may include watchful waiting. If gallstones are not causing symptoms, asymptomatic, a wait-and-see approach may be taken. In such cases, regular checkups and monitoring are done to assess if any symptoms develop or if the stones change in size. Lifestyle modifications. For some individuals, making lifestyle changes can help manage gallstones. These may include adopting a low-fat diet. Reducing the intake of fatty foods can decrease the gallbladder's workload, which may help prevent gallbladder attacks. Losing weight. If the person is overweight or obese, gradual weight loss may reduce the risk of gallstone formation. Medications. In certain cases, medications may be prescribed to dissolve cholesterol gallstones. These medications, known as bile acid pills, work by breaking down cholesterol in the gallstones, but they may take months or years to be effective.